It's been long known that stress can wreak havoc on our immune system, cause changes in our personalities, and disturb our sleep. But new research points to links between stress and our mouths. I, for one, am a clincher, for sure, at night. Here to share more is Dr. Stephen Daniel, board-certified periodontal surgeon and incoming president of the American Academy of Periodontology. Dr. Daniel, is that right? Can stress wreak havoc on our smiles?
Indeed it can, Rose, and good morning. I tell patients in the office that it's a challenge. You can't really have be healthy without having a healthy mouth. And stress is something that can be a roadblock to having a healthy mouth. In this particular case, it appears that stress, chronic stress, which tends to alter the flow of saliva in the mouth, seems to have an effect on bacteria building up around the teeth, and that predisposes people to both cavities and periodontal disease. And periodontal disease is the #1 reason adults lose teeth. So that chronic stress and that impact on your saliva definitely can wreak havoc on your smile.
That's good to know. Definitely good to know. It's also known that stress leads to bad habits like overeating and smoking, which are bad for you physically, of course. But is it true that stress also can play a factor in our oral health?
Indeed it can. I know that the first article that I read over 20 years ago that linked chronic stress, in this case it was financial stress, with an increased susceptibility of periodontal disease is where we began to realize that this chronic stress, by having an impact on our body's immune system, its ability to fight disease, its ability to heal and recover from infections, that predisposed us to gum disease as well. And so there's a definite link between chronic levels, chronic stress, and our oral health.
This is so good to know. This is so good. Thank you so much for sharing this. What exactly is periodontal disease?
Periodontal disease is an infection. It's caused by certain types of bacteria commonly found in the mouth. And in that 1 out of 2 of us over the age of 30 that have the disease, the gums have become inflamed, and then that infection spreads down to actually begin to attack and destroy the bone of the jaw and the tissues that actually link the root of the tooth to the bone of the jaw. That's when tooth loss can occur, and that chronic infection is what seems to have an adverse impact on our health and increases risk for things like cardiovascular disease and stroke, just as one example.
All right, that makes so much sense. Now, you mentioned that gum disease is linked to heart disease, diabetes, and Alzheimer's, and even poses risks for pregnant women. Can you tell us a little bit more about that? Like, what kind of risks do pregnant women face?
Of course, the common denominator, Rose, seems to be inflammation. When the infection is untreated, the level of inflammation and inflammation-causing chemicals that circulate through the body are elevated. Specifically when it comes to women who are pregnant, that seems to be able to trigger premature labor, which can result in low birth weight babies. That appears to be the risk for women who are pregnant and, of course, women who are considering becoming pregnant.
Wow. So good to know. I bet you there's millions of Americans that don't know that. Is there any good news when it comes to gum disease and ways that we can prevent it?
You know, actually, there are. I'm in my 35th year of practicing, and every day I still think this is a time of great opportunity for periodontists, for our patients, for the people that we are still have yet to treat, simply because we have techniques and technologies, Rose, that make it so much easier for us to help people preserve their natural dentition in health, hopefully for a lifetime, and even other technologies when that's not possible, to replace teeth with things like dental implants that, although they're not teeth, they're the closest substitute we have. And so there's lots of good news out there for patients, and in terms of getting from where they may be now back to a state of good health and good function.
Now, where can we go and find a trained physician on gum disease?
Go to perio.org, perio.org. That's our Academy's website. It can provide, number one, some excellent information about periodontal disease and how it's treated. It also has an easy-to-use tool to find a periodontist near you who your listeners can work with, who will work with your listeners' dentist and hygienist to help them obtain and maintain good oral health.
Perfect. Thank you so much.
Oh, it's my pleasure, Rose. Enjoy your day.
You too.
Bye-bye now.
Bye-bye.